like to call on stage Dr. Kaustubh sir, who is Director, Asta Oncology Associates, and is one of the leading head and neck surgeons pan-India.
Very good morning and warm welcome to all of you to this ISTS 2025 at Ahmedabad. This is a first ever Indian consensus on IONM, and most of the authors are here in this conference, except maybe Pradeep has been not able to come, but all others are here, and they represent the government institutions, private institutions, single institution where there is a dedicated thyroid surgery being done in a large number. So these are all high volume center representatives who got along and made this consensus. And they are all here in the conference, so you may meet them in the coffee time and discuss more than what we are providing you in this instructional course. This is the team. The background is that during thyroidectomy, the preservation and integrity of recurrent laryngeal nerve and external branch of superior laryngeal nerve are most important. And the previous speakers have elucidated all these important reason why we should sort to the IONM. Why we needed this? Because there were no existing national guidelines. We wanted to improve the patient safety and outcomes, high cost of global protocols, because we always try and follow global protocols, but then we realize that because of the resource constraints and our own demography, we might not be able to follow those. Of course, we needed a medico-legal clarity also. And as there was a question from Shilpi that, what happens? So we need to find out in our scenario also how these all issues can be tackled at a later point of time. And that's why this was the objective for doing this maneuver of coming to a consensus. And we drafted this consensus with the literature review. Prathmesh was the leader in then compiling everything, and all other helped him. We had 3 modified Delphi rounds, and the cutoff was minimum 80% consensus level. Then only that goes for a consensus, and the voting took place from November 24 to December 24. There are 18 evidence-backed guidelines across 9 themes which we tried to propose. So these are the statements. You can get all the entire article even on the website, as well as from the maybe Medtronic stall outside. You can have a printout also if you want. They will be helpful to give it to you. But essentially, these are the statements which we all came to a consensus when we made this 9 themes to guide the Indian surgeons while they dabble into using IONM, and then we would like them to master the art. Deepak told me that we want to finish off early and we want to have some interaction from audience. So that's the reason why I am going a bit fast on this consensus. But we can discuss this if you have particular issues. Even in this consensus guidelines, if you have some issues, we can discuss. Nerve preservation will impact the practice. If we have less injuries to nerve, it will have a better practice outcomes for doctors as well as our patients. And these are the things which we would like to promote to our community. And we feel that this will shape the future practice in thyroid surgery, at least in India. This is the team which made this guideline. Thank you. You have some questions, or we can take it at the last round. Yeah, this is it. So I think I will invite the entire course faculties on the stage, and we can take some questions. Anuja? Parthiban?